welcome back to my channel. Myself Monica, and once again we are back. I am back with a very nice video, that is peptic ulcer disease. In Nepal and India and almost I think in the entire world, peptic ulcer is now a burning problem. Every person, like in my class also, there is my friend who has not a peptic ulcer but a kind of disease which is quite similar to it, because we are having stress, we eat very unhygienic foods, and our lifestyle is not very good, and we are very curious towards our health, and especially to our stomach and everything. So that results in a very different types of gastritis and gastric problems. So one of the problem that is very common is peptic ulcer, and today we are going to discuss about it. We will be solving MCQs. So let's get started. My MCQs generally are for everyone, from USMLE students to an MBBS students to for one who is preparing even for the entrance examination, to everyone, for PG student, to everyone, because peptic ulcer is needed for everyone. MBBS student also should know about peptic ulcer. PG students should also know about peptic ulcer. Even one who are preparing for USMLE should also know about peptic ulcer. For the entire life, in a doctor's entire life, one should know about peptic ulcer. So let's get started. First of all, I'm starting with the definition, because if you are an MBBS student, then you have a high chance of being asked about peptic ulcer in your vivas, because it's a very important topic. So generally in Nepal, in our vivas, peptic ulcer is one of the very much asked question. And the next one is the occurrence of peptic ulcer. They asked us, like, tell me about define peptic ulcer and mention the site of occurrence, in the descending order and the ascending order. So they asked in that way. So while given definition also, we need to satisfy our vivas teachers. They should get satisfied with our definition. So the four things, let me tell you that four things that you should not miss in your definition is: it is a chronic condition. Chronic, most often solitary lesion that occurs in any part of the GI tract. Okay, any part of the GI tract that is exposed to aggressive action of acid peptic juices. Okay, four things: it is chronic, solitary lesions, any part of GI tract, and action of acid peptic juices. Okay, so this is the general definition of peptic ulcer. Now the first MCQs says, okay, the most common site of occurrence of peptic ulcer is, okay, and I have given here, I think I have given here 6 options. So the option A says first part of the duodenum, especially anterior wall, stomach, usually antrum and lesser curvature, gastroesophageal junction in setting of gastroesophageal reflux or buried esophagus, within the margins of gastrojejunostomy, in duodenum, stomach and or jejunum of patients of Zollinger-Ellison syndrome, within or adjacent to Merkel's diverticulum that contains ectopic gastric mucosa. So I think this is ectopic, okay? Ectopic gastric mucosa. We have already studied that it can occur in any part of the GI tract. So we can't say that so because there is no definite point. So I have just asked you the most common site. So you have to remember the most common site. So once, let me write you here: 1, 2, 3, 4, 5, and 6. This is the descending order. Okay, descending order in the occurrence of the peptic ulcer. Okay, this is the descending order of the site of occurrence of the peptic ulcer. That means the first part of the duodenum, especially the anterior wall, is the most common site of occurrence of the peptic ulcer. So first part of the duodenum, especially the anterior wall, is the most common site of the occurrence of the peptic ulcer. And after that, second one, it comes, that is stomach, usually antrum and lesser curvature. Then there is gastroesophageal junction. Then within the margins of gastrojejunostomy, and so on. So you have to remember everything, okay? You have to know this everything, because you will definitely be asked this, you are going to definitely be asked this on vivas. And you should also know about the most common side and other things, okay, about the occurrence of the peptic ulcer. And this was about the question number 1. I'm not explaining it too much, because if I start doing that, then it will be very lengthy video and it will be very boring to watch. So I'm just making it short and sweet. If you want further knowledge, then you can go through your textbooks, you can go through the different other teachers lectures, where you can get the very nice explanation if you want more there, and you can study it. So now let's us go to the question number 2. So now let's go for question number 2. The question number 2 says, which is the most common damaging factor to cause peptic ulcer? So this is important, okay? So we do know that which is the factors that tends us to cause the peptic ulcer whenever, okay, it is very important. So I have given you 4 options, but there are many factors, and let me tell you in the beginning only that these 4 options are correct. Okay, these are all damaging factors which causes the peptic ulcer. But now I'm asking the most common damaging factor. If you go to books, then you can see, okay, you can see that anesthetitis and H. pylori both have been considered to be equally the most common damaging factor that causes the peptic ulcer. But if you are asked to choose one, then I suggest you to go with the Helicobacter pylori, because it is found to be the most common cause to be the reason for the peptic ulcer. And all these 3 are also the all others 3 are also the regions of peptic ulcer. So you know, these things damages what we say that wall of these our gastric mucosa, and they tends to cause the peptic ulcer. If you want to go in the depth of detail of H. pylori, anesthetitis, gastric acid and smoking, and please you can visit book. Here I will just discuss you the common damaging factors more than this, that is anesthetitis, H. pylori, gastric acid and smoking. They do cause an injury to gastric mucosa, but other than these are alcohol, gastric hyperacidity, duodenal gastric reflux. Other are also the causes which are the damaging factors. But what are the things that these factors damage, that you should also know, okay? Now these are the damaging factors, you understood that, but what are the things that they do damage? So these things that they damage are the mucus and bicarbonate secretions. Okay, next thing is mucosal blood flow, prostaglandin production, epithelial regenerative capacity. So they damage these things which results, these are the like the protective shields, okay, in our GI tract, okay? So when they cause damage to these things, then that results into the peptic ulcers. So just remember, the damaging factors can be smoking, alcohol, duodenal reflux, anesthetitis, H. pylori, even gastric acid also tends to cause the peptic damage. So to manage it, there is prostaglandin production, okay? But if prostaglandin production is less, then what happens? Gastric acid production will be more, and then that leads to the peptic ulcer. Mucus and bicarbonate secretions is for the maintaining the alkalinity of the or the pH of the pH environment of the gastric mucosa, to maintain the alkalinity in the blood. That is also important. If that gets damaged, obviously there will be high acidity. Epithelial regenerative capacity is also important. So these factors, and there are many things to study under them, but for this video I'm just explaining you, I'm just saying you the major factors and the protective sheets for the peptic ulcer. Now let's go to the question number 3. So now we come for question number 3, and question number 3 says which blood group is more prone to peptic ulcer. So in these 4 options, the correct one, let me directly go to the answer. The correct one, the one which is very prone to peptic ulcer, nowadays it has been found it to be the O blood group. Okay, it is more prone to peptic ulcer, whereas B and AB blood group are lesser prone to peptic ulcer. They are lesser prone to peptic ulcer, whereas O blood group is more and more prone to peptic ulcer. Now this thing about why O blood group are more prone to peptic ulcer, this thing has been studied by scientists, and few things has been concluded. The first one is that in O blood group, the Helicobacter pylori, okay, in the O blood group, Helicobacter pylori binds more. So in O blood group, it was found that Helicobacter pylori, it increases the binding of the Helicobacter pylori to the epithelial cells. Okay, in O blood group people, the binding of Helicobacter pylori to the epithelial cells is highly increased, because of which there is the colonization, denser colonization of epithelial cells, and there is increased inflammatory reactions as a result of bacterial binding in group O people. Okay, and that is the reason why O group people are more prone to the peptic ulcer. So high epithelial colonization and inflammatory reaction due to binding of H. pylori. Okay, as pylori tends to bind a lot with the epithelial cells of the O blood group. This is one region. The next region is also there. That is second one is the serum pepsinogen level. Serum pepsinogen level is also thought to be the factor for high chances of peptic ulcer in O group people. So a study looking into the mechanism of this association showed that serum pepsinogen level was found to be of greater for individuals with blood type O. It is believed that the variation in the quantity of serum pepsinogen in relation to the size of the gastric secretory cell mass might be reason for the peptic ulcer. So there has not been ever found the fixed answer to this question, but at least you remember that O blood group is more prone and the other two groups are lesser prone, and the things are higher binding of H. pylori and the serum pepsinogen level. This is question number 3. Now let's go to question number 4. So in question number 4, the question says the bleeding in duodenal ulcer is due to. So we have already studied in first question only that reason for the peptic ulcer means the ulcer in different part of the GI tract. It can be duodenum, it can be stomach, or any part. Okay, so question is when there is duodenal ulcer, when there is ulcer in duodenum, then there is bleeding. What is the reason? Which artery is the reason for that bleeding? Okay, where from which artery damage causes that bleeding? So in duodenal ulcer, the bleeding is generally due to gastroduodenal artery. So duodenal, gastroduodenal artery. It's very easy and you should know it. It's important to know if there is bleeding from gastroduodenal artery, then you might analyze it that okay, it might be duodenal ulcer, isn't it? But if there is bleeding from the left gastric artery, then it is the stomach ulcer. Okay, if there is bleeding from the left gastric artery, then that is known as the stomach ulcer. So you have to know from which artery there is bleeding, then you can differentiate whether it is stomach ulcer or that is duodenal ulcer. Now this might be the your last question, last MCQ for today, but don't think that you have just studied 5 MCQs. You have studied a lot of things. Anything can be made as your MCQs. You have also prepared for your vivas. So MCQ and vivas you have prepared both together from peptic ulcer disease. So now the 5 number the question says the most common complication of peptic ulcer is, and you have given the option. So this is also a very important Viva question. This is also a very important Viva question. Now, the complication of peptic ulcer disease, you have given bleeding, perforation, gastric outlet obstruction, and malignancy. So, I think that already we have discussed about bleeding. Okay, about gastroduodenal artery and left gastric artery. We said that these are the artery that causes bleeding in duodenal ulcer and the stomach ulcer respectively. So alright, so I think you can get an idea, a hint of an idea that okay, the most common complication for peptic ulcer could be bleeding in the number 1 number. Okay, bleeding in the number 1 number. So when the ulcer erodes, okay, the muscles of the stomach or duodenal wall, okay, blood vessels may get damaged now, and when blood vessels get damaged, what happens? There is just the bleeding. Okay, so the affected blood vessels may be small, so they may result into the blood may slowly sweep into the digestive tract, so that also may result into anemia. So peptic ulcer disease may also result, if excessive disease, then anemia due to the damage of the small blood vessels. Okay, and then next thing that you should know is the perforation. So perforation means, okay, it is a condition, okay, perforation is a condition where an untreated ulcer has been burned through the mucosal wall in a segment of GI tract, allowing the gastric contents to leak into the abdominal cavity. So when the part of any part of the GI tract get perforated, the ulcer gets get inside, buried inside the segment, and that causes the leakage, perforation. So when perforated, that causes the leakage of that gastric content, or that part into the abdominal cavity, which is also the next complication for the gastric ulcer. So you can generally understand it as the hole in the stomach or duodenum. It is a case of the medical emergency. So first bleeding, then next one is the perforation. Now the other things that you should know, that in bleeding, okay, because of bleeding, 25% of the people, okay, peptic ulcer people who has got bleeding, they die. Okay, it is very life threatening. It is the first indication of ulcer. It is also the first common complication and first indication of the ulcer. The peptic ulcer, okay, accounts for the, it is also very perforation is also very emergency condition. It also accounts for 2/3 of the death in the patient of the ulcer. Okay, it occurs in the 5% of the patients. Means if 2/3 of the people who have perforation, they tend to die because of this problem. Okay, it is really the first indication, but yes, it is a most common complication. It is not the very first indication, but it is a common complication. The next one is the obstruction or the gastric outlet obstruction. So it occurs in the 2% of the patient. It is not very common, and it occurs in both the pyloric and the duodenal ulcer. So when there is obstruction in the gastric outlet, you can have the symptoms like cramps, abdominal pain, those kind of symptoms you can see because of the gastric outlet obstruction. And the next one is the malignancy. So malignancy means 1% of the gastric ulcer generally turn out to be malignant. Okay, and malignancy is generally associated with the gastric ulcer. Okay, it is not much common in the duodenal ulcer. It is generally associated with the gastric ulcer. So malignancy is generally associated with the gastric ulcer, and it is less common associated with the duodenal ulcer. It is 1% of the peptic ulcer that turns into malignancy. So this was about the complication of the peptic ulcer. So anemia is also the reason whenever you get the peptic ulcer. So the clinical features, as I already said, that epigastric pain is there. It is usually usually get worse at night. Okay, the pain usually get worse at night. There is nausea, there is vomiting, there is bloating. Okay, because there is always the damage of the GI tract. So this is all about the question number 5. So now the other things that you should remember that is very important is the urea. Okay, it's urea, BREATH, breath test. So you have to remember urea breath test. So this urea breath test is used to ensure the efficacy of the treatment for the peptic ulcer disease. So please remember urea breath test to understand the efficacy of the peptic ulcer disease. And the next thing that is very common peptic ulcer disease, that is duodenal ulcer and the stomach gastric ulcer. You please go through their difference between, do understand what is the difference between them, and what is their incidence, what is the age of occurrence and etiology. Other things are very similar of all the peptic ulcer diseases. They are also, their gross features, microscopic features are similar, but there are few things that are quite different in duodenal ulcer and the gastric ulcer. That is also very important. Please go through that in your book. So that's it. So for today, I hope that you like this video. If so, then please like this video, please share it, and please subscribe to my channel. Thank you so much. Take care. Have a nice day.